So what is your current job and specialty?
I'm a home health nurse, and I actually do transitional care in the hospital.
Okay. And then where do you work and who do you work for?
Uh, I work for Bayada Home Health, but we're contracted through MUSC in Charleston.
Okay. What does your typical day look like with your job?
So I get referrals from the hospital about patients that are going to need home health, and I go see the patient and describe to them what home health is and what to expect when they get home. And then I basically make sure all the orders are in and help with the transition from inpatient to them receiving home health services.
What's your favorite part of your job?
Getting to see the patients in a non-clinical setting, really. It takes off a lot of pressure and helps the home health nurses out a lot whenever you get to go in there and describe what to expect, because a lot of times they expect a lot more from a home health nurse. They expect like home care
Mhm.
instead of home health, which is two totally different things.
If you had to pick the most difficult part of your job, what would you say it is?
Keeping up with the referrals, we probably get anywhere from 20 to 40 a day. And MUSC is a pretty big campus, so making sure we get in contact with all the patients, keeping up with all the doctors, making sure we're getting the orders, and making sure all the documents that need to go over to the office get sent.
If you could give yourself one piece of advice as a nursing student, what would you say?
To study smartly, just because you study for a long time doesn't mean you're going to do well on a test. Making sure that what you study counts, and don't put too much pressure on yourself.
If have you faced any challenges with the current COVID crisis and how's it affected you, like you seeing your family or hanging out with friends or whatever you would normally do on a daily basis?
So I still see patients in the home every once in a while, and not being able to go out with friends and stuff to make sure that I don't get COVID, because I'm basically would be exposing patients to COVID because they have to be homebound in home health, that it kind of affects it that way, that I can't do what everybody else gets to do.
And have you had any restrictions with your family?
Yeah, well, I'm from Pittsburgh originally, and I live in Charleston. So my sister was pregnant over the summer, and I was supposed to go home for a week, and obviously wasn't allowed to go home. I have a lot of nieces and nephews, and my sister's a teacher, so they didn't let me go home.
Okay. And then has the COVID crisis affected your outlook on nursing as a career at all?
Yeah, definitely. I had a time where I had a patient that was a COVID positive in the home, and I wasn't allowed to work for 2 weeks, had to quarantine, all of that. So it's definitely, you're more at risk, especially if you're working in the hospital with multiple patients with COVID. But in the home, you never know what you're going to get, especially if they have visitors that you don't know were even there that were exposed.
Absolutely. Well, thank you for your time, and I appreciate you meeting with me today.
Thank you.